Hello, everyone. I want to thank you for joining us today for our COVID-19 update. We are now live. I am joined right now with two dynamic young men, Shomari, Tate, and Tyler Logan. Deacon Shomari and I started this conversation last week, and what we wanted to do was kind of look at this from a legislative lens, and now today what we're going to do, we're going to add a public health and aspect to it with Tyler Logan. Tyler, can you introduce yourself and give us the 30 seconds of who you are? You know what I mean?
Yeah, good afternoon, everyone. So my name is Tyler Logan. I graduated from Michigan State University. Go Green! Shout out to all of us. I got my bachelor's degree in health and society. My master's degree was health and risk communication. All of it public health epidemiology focused. A lot of my research experience has come in regards to studying health disparities and things of that sort. So I'm excited to be here today.
Yeah, man, we're glad to have you. And Shamari, give them the 30 seconds of you, and we're going to get this party started.
Yes, sir. Hello, everybody. I am Deacon Shomari Tate. I graduated from MSU in 2017 with a bachelor's in poli-sci, then a master's in public policy in 2019. I am currently a seminarian and really excited here just to get going and keep this discussion going. We've had a good first two sessions, and I can't wait to dive in right now to the meat of the public health perspective of this COVID-19 pandemic.
Yeah, so I want to thank you guys for joining us. Now, listen, folks, we're going to have all kinds of other professionals that will be joining us for this discussion. So if you are listening and you want to be a part of these discussions, listen, put it in the comment section. You can email me, and we want to make sure we have an open discussion. Now, let me just put it out here. We are not experts, right? We are not experts. Tyler is not a public health expert. Right? Shomari is not a public health expert, and you know your boy, I am not a public health expert. Our job, our goal is to get information out. We want to put some information in front of you so you can do your own research, and good leaders ask questions, right? We look at data and we ask questions. And so let's just jump right into it here. And we talked last week about, okay, so we know that there are various corporations that are working on vaccines, and they're trying to, develop, vaccines, and they're saying we're 12 to 14 months out from that. They moved that back, and there's all this activity. But what we wanted to do was to say, hey, look at some of these vaccines or treatments that are being developed right now and being tested. So let's jump right into this. Shomari, tell us a little bit about this hydrochloroquine that the president's been talking a lot about.
Yeah. So again, disclaimer here. This is just some research just to encourage you guys to go and do some digging yourselves. So hydrochloroquine, we've all seen the president talking about it. It's a drug that was used to treat malaria, and studies have shown recently that it doesn't really have a significant impact on COVID-19. And experts have advised against using this drug because it does show potential toxic side effects on the heart. If we jump down to convalescent plasma, this is a very, very old treatment that's been used where they take the plasma, which is the liquid portion of the blood, and they use the antibodies from that blood and inject it into someone else. So it's very similar to a vaccine, but with a vaccine that is injecting a toxin into someone so antibodies can be created, versus with convalescent plasma, you're really taking antibodies and directly putting them into someone. And then this last one here called remdesivir, this was used to treat Ebola. And then a 2018 and 2019 trial showed that it was ineffective in Ebola, and current trials are underway in 90 different countries around the world to see if it's effective in treating COVID-19. And studies are waiting, and we're anticipating over 600 different trial studies to become available for us in the month of May to see how effective this drug is.
You freaking me out. Whoa, you freaking me out right now. I'm on this thing. I'm listening to what you're talking about. Look, my brain does not function that fast. I know y'all feel me out there. And so, like, listen, I mean, you're not going to hear this in no press conference, but these I can't even, let's be honest, right? I can't even pronounce this stuff. You know that whatever's on this screen, I don't know. I don't know if it grow on a tree. I don't know if there's a remdesivir tree in Africa, in Jamaica somewhere, but you gotta go and you gotta read about this stuff. Tyler, you got something you want to throw in on top of this?
No, the only thing I'll add is that I said no, and then I'm adding. The only thing I'll add is that if seeing this and hearing those numbers scares you, don't be frightened. The fact that there are so many different trials on vaccines and medications and things that we're looking into as public health professionals, specifically epidemiologists and those at the CDC, the Center for Disease Control, as well as WHO, World Health Organization, things of that sort. Because there isn't a lot of research for COVID-19, it's new to us. We're seeing what works from previous diseases or from previous pandemics and epidemics and things of that sort. And we had a lot of those. So we're doing a lot of research in that realm and in that regard. So don't be alarmed by the amount of research and trials out there for this. It'll happen eventually in time. But I'm faithful. I have in it. I'm hoping.
And just again to add, this is just a transfer of information that we are giving to you guys. It's a transfer of info. We are not here to freak you out, just trying to show you what's out there and what's being done right now in the midst of all this craziness.
Yeah, and I think that's key, man, that we communicate, and we are a team. We just want to understand, like our hearts is to put this in front of you. And, this isn't an exhaustive list of everything that's going on, but this is a great start. And when we look at it, this is one of the issues that we wanted to bring up, was that there are so many disparities as it relates to, COVID-19 and just the healthcare. So when you look at Black Americans are disproportionately dying from COVID-19. Like when I look at this is what I see. And you guys correct me if I'm wrong. Like in the state of Louisiana, right? If our research is correct and the data is correct, we make up 33% of the population, but 59% of the deaths. And so automatically that brings tears to my eyes. That is not to diminish white deaths, Hispanic deaths, Asian deaths, or any other deaths. We are simply taking the lens and we're focusing in on a particular demographic, right, that we happen to be a part of. So to me, that says something, and I'm not sure exactly what that says, but it says that there's a problem, right? If I look at Illinois, we're 15% of the state's population, but 40%, what you're telling me is that in Louisiana, we're over half the deaths, and in Illinois, we're almost half. Like, man, somebody make sense of this.
Okay, so basically, the general mantra is that COVID-19 has been what experts, scholars are calling the great equalizer, and that it affects everyone. But what these graphs here are showing is that African Americans are actually disproportionately affected because of a lot of varying different external factors. Tyler, do you want to get into some of the external factors that could affect African Americans?
Yeah, so basically, there are so many different examples of some of those factors, which all tie into historical, systemic barriers that have been around for many ages and millenniums. Essentially, some of these may look like, for example, a systemic barrier could be you going into a hospital as a Black patient and hoping to receive some type of service because, let's say, for example, you have some type of heart issue. You've been having trouble breathing, so you go to the doctor. The doctor is white, and due to the doctor's perceptions based off of what society has placed here in the United States, and stereotypes and things of that sort, based off of that doctor's perceptions, you might be under diagnosed. So you might not be given the correct medication or the quality of medication because of the perception that you may be a patient, a Black patient on Medicaid and things of that sort. So perceptions like that and biases like that have for long ages and for decades have been increasing the barriers and the health disparities within minority populations. And as we see now that COVID-19 has really ramped up in some of these minority populations, Black communities are being disproportionately impacted and hit the hardest.
Yeah, and just to dive a little back into the application side of things, Black Americans also work jobs that are now in the pandemic deemed essential, which means that they are in more contact with this virus. There was a term coined that people need to eat. And in this country, if you're going to eat, that means that you got to go to work. You know, we can't sit back and take leave time because we got to pay for our bills. We got to go out and do all these things and this and that. So we're on the front lines of this virus, and that is also another contributing policy factor from the Bureau of Labor of why we're being disproportionately affected.
Yeah, this is a deep conversation, guys, because you know we have to do what we need to do to keep ourselves safe, our family safe, our community safe, our children. You know what I mean? And you know, we were getting reports that kids that are out of school are running around in the streets, doing all like there's nothing going on. And so I want to invite those that are listening to us to take your communities, your small communities, and talk about like how can we keep ourselves safe. You see the graph here, right? And one of the things that I really appreciated about this slide is that if you don't know that you have a problem, you can't fix it. If there's no data that some empirical data that shows that hey, there's something actually going on, then you won't be able to develop a strategy. And so, I like this quote. It says, without racial data, we can't see whether there are disparities between the races in coronavirus testing, infection, death rates. If we can't see racial disparities, then we can't see the racist policies behind any disparities in deaths. If we can't see racist policies, we can't eliminate those policies or replace them with anti-race racist policies. So you guys want to jump in real quick before we go deep on this? Like, a lot of times people will say, well, prove it, and we operate out of emotions. Well, I don't see it. And I know I have friends that are doctors and I have friends that are nurses, and that's not how they are. However, when you go back to this slide, something is going on. You know what I mean? Like something is going on. And so I just wanted to open it up for some brief comments on this.
Yeah. And like we said, the disclaimer is, none of us here are experts on these subjects. We're simply providing our perspectives. And Dr. Kendi here, he's one of the leading anti-racist professors in the country at American University. And here you see it in plain proof. His perspective on this issue right now is that we need more data. We need to really dive deep into this topic and see why is this happening to us on such disproportionate levels.
Yep. As an evaluator myself, we do a lot of research, quantitative, qualitative, and everything in relation to both of those. And it's really hard to make an informed decision if you don't have the background information to back it up. So that's where a lot of this call for racial data is coming from. Scholars across the country are calling for racial data to be provided by each state, because we need to see what that data look like, what those datas look like, and kind of just tackle it head on, make informed decisions based off of evidence-based data.
And just to add real quick, not just on this topic, but racial data is lacking in just about every single topic that we can think of, from health disparities to police violence to housing to socioeconomic disparities. So there's a lack of data on almost every single front in the perspective through the lens of race when we're talking about legislation.
Yeah, one of the books that really opened my eyes a while ago was the book Medical Apartheid.
Yeah.
You know what I'm saying? I think it was Harriet Washington or whatever. And that is a great book that chronicles our relationship with the healthcare industry, dating all the way back to the plantation and slavery, right? And I think a lot of times we need to educate ourselves as to why Black men don't go to the doctor. We're averse of going to the doctor, right? We try to figure it out on our own. And, these disparities that we're talking about, I'll give you an example for all of our listeners. I had some stomach pain, and I went to the doctor, and I was trying to explain it to him, and he just wasn't getting it. He pushed me and, everything, and he just wasn't getting it. Finally, he said, well, try this. And he gave me this prescription, and it was like some extreme ulcer medicine. Now, he hadn't really diagnosed me. He didn't recommend for me to go to a specialist right? He was like, well, normally if you're feeling this way, then your pain should be over here. And I was like, no, I'm hurting right here. So he gave me this medication, and when I got in the car, I was so frustrated, I didn't take it. I put it in my glove box. It was 15 years later that I went to another doctor that did another battery test and found out I had an antibacterial imbalance in my stomach. I lived with that thing for 15 years. I was in pain. And so I can give you personal stories. So let's talk a little bit about the health disparities and equity implications of COVID-19. Tyler, dive right into this.
Yeah, so I'll jump into health disparities and the equity implications. But before I do, in general, and I might have thrown this in the presentation, I can't remember, they're all kind of merging together now. I've been doing presentations left and right since this thing has came out. But health disparities essentially are basically things that create barriers for people of color. These may be systemic, these may be social and things of that sort, but they're barriers to health that some specific demographic is facing due to historical systemic policies, structures, and things like that within the health field. So the National Association in Advancement for Colored People, the NAACP, has come up with these 10 implications of COVID-19, and these were the implications that were created last month. So they may have been updated at this point, or more implications may have been added to this. However, as of last month, when this report came out, the implications where racism and stigmatization has increased, particularly towards Asian and Asian American populations. So if you remember a few weeks back, we heard President Trump talk about the coronavirus, and he called it the Chinese virus. Things like that increased racism and stigmatization towards Asian Americans within the United States. More cases in police reports were, more cases and police reports were collected and received based upon just that incident alone for this specific population across the board. Certain populations are also at an added risk of exposure, particularly immigrants, incarcerated people, and people of that sort. So for example, within the jail structures, you have individuals who are already so close in proximity. Across the nation, jails have some of the worst settings for individuals to actually live and just have a daily normal life in. And we understand that as scholars, as researchers, that the facts and the data are out there that support that. However, when you put people in close proximity along with a virus within a pandemic that spreads easily within that close proximity, you have issues. So for example, those populations are at an added risk of exposure, and jails across the country have been releasing inmates because of that.
Wow.
Frontline workers face tough choices between going to work and not going to work, risking exposure and not risking exposure. As we mentioned, a lot of our frontline workers or essential workers here in Michigan are people of color, and that's just a daily reality that a lot of people have to face. Do I want to go in to work and risk exposure to collect a check, or do I need to stay home with my family? Childcare services have shut down for many people, so it adds another additional barrier or disparity within this time. We also see that there has been continuously shutdowns of public outings. Last time I checked, I believe it was like less than 10 people in a room is appropriate, but no more than that. And that in itself is just within like a normal social setting, not necessarily related to workplace environments. But in general, with that being said, the census and voting may be jeopardized because public outings have dwindled down. Coronavirus remediation will result in increased exposure to toxic cleaning chemicals. I don't know about y'all, but I've been wiped. My counters have never been cleaner, bro. Like, I wipe these things 3, 4, 5 times a day. I'm spraying stuff with antibacterial spray. So things like that can increase the toxic cleaning chemical exposure. And that might also have health risk and health concerns for individuals. As we know, children and college students, they're risking exposures and things of that sort. There's a lack of accessibility to testing kits for people across the board, everywhere across the country, but especially in communities of color. However, there have been a lot of funders. The government has stepped up a little bit to provide more resources for these COVID-19 hotspots, such as Detroit, for example. We'll get into that a little bit later. And then ultimately policies are unfolding that risk human and civil rights. Coronavirus has already been used to justify increased militarization and restrictive immigration policies. And then, of course, denial and misinformation are one of the worst things that can happen at this time, but they are continuing.
Yeah, because when this first came out, they were saying that the coronavirus wouldn't affect black people, that black people, that we wouldn't get.
We were immune, right?
Yeah, we were immune. You know what I'm saying? And we saw that was a total misinformation. It was a lie, right?
Yeah.
So let's take us here, because I got a lot of people on the chat feature. I want to look at the chat here, and people are saying, "Okay, I got you. Like, well, what can we do, right?" And I want to say this. We want to rush to the do it. I get it. We really want to provide some solutions, but let's look at some of the data so that we can even implement a broad stroke, a more specific strategy is what I'm trying to communicate. What is this slide? What are we looking at here?
Yeah, so disparities affect people of different demographics. And as we see, COVID-19 has really targeted individuals, though the Black population has been impacted significantly by this. And we'll jump into that in the next slide. I did want to highlight that age is a big demographic for hospitalization within COVID-19, for your risk for COVID-19 and things of that sort. So as you look at this chart, and it was put together and founded and funded through the CDC. But as you see, the age demographics increase from 0 to 4 all the way up to greater than 85. And as the age increases, so does your rate for hospitalization for COVID-19. So for example, children ages 0 to 4 have the lowest rates for hospitalization for COVID-19. I also saw research and data in a previous article that said children between the ages of 0 and 10 have the lowest rates for contracting the virus in the illness. And then as you see on this graph, going all the way up to 85 plus, your rates are then increased to 17.2. So this is alarming, especially for those of us who have middle-aged parents, family members, friends, people that we really care about, as well as older adults. So we really need to encourage everyone, not just older adults, but everyone to stay home, to use face coverings in public settings, and to wash hands frequently. The reason I say everyone is because although this chart specifically targets those of a higher age demographic, we oftentimes communicate and interact with them. Although I'm 25 and my mom is in her 60s, I understand that if I do contract coronavirus, my rates of survival are higher than my mother's. However, I can still pass that along to my mom. So because of that, and because of other individuals who I could pass that along to, who may be more susceptible to the disease, we also need to practice those stay-at-home face coverings, hand washing, and other components.
Now, this is important because, and I want to put us all on the screen here if I can. Yeah, this is important because as church leaders, religious leaders are looking at the economy opening back up and these restrictions being lifted, we have, as leaders, we have a responsibility, and our motto is safety first, right? Safety first. So the reason why we are going through these different modules and topics is we want to understand what our risks are, where we need to pray, right? And so I really appreciate you sharing this. What about this? Like, where do we go from here now?
Yeah, so what's really important about this is similar to the age demographic. Again, Black people are disproportionately impacted by COVID-19 hospitalization. So as we see here, you do have different colors. So the blue color is just the percentage of residents living in COVID-net counties. COVID-net counties are basically counties that are housed in this surveillance system that's tracking the number of COVID-19 hospitalizations within that specific county. And then the orange color is the percentage of COVID-19 hospitalizations across the board. Their population size that they used for this research was 580. So similar to a graph that we seen a while back, I think it was maybe 3 or 4 slides ago, that showed the demographics or the population for Black people in, what was it, Indiana or Illinois, compared to those who actually contracted the disease. Here we see something similar. We see non-Hispanic white, we see non-Hispanic Black, and we see Hispanic. Non-Hispanic white is just a research way of saying white people. Non-Hispanic Black is a research way of saying Black people. And we see that the rates for hospitalization looks larger in the white demographic. However, when you take into account the number of that specific population, we understand that that number seems a little bit more reasonable compared to the 18% and the 33% that we see within the non-Hispanic Black. So across the board, these numbers are higher than our general percentages within populations for the most part. So we're disproportionately being impacted, meaning that the number of Black people within these communities, within the nation, or within this specific data set, but also translatable for the nation, the number of Black people in those communities are contracting coronavirus at higher rates, are impacted by coronavirus at higher rates, are hospitalized by coronavirus at higher rates compared to other demographics.
And
Go ahead.
just to chime in, because I've seen some comments on the feed about what we're doing. So in our state, in regards to all of this, Lieutenant Governor Garland Gilchrist has started the task force on racial disparities in healthcare, and that was started because of the death. I can't remember her name, but she was a 5-year-old girl, and she passed away. And this task force is being conducted in her honor. She is the youngest case that we know of to pass away from COVID-19, and right now they are looking into the disparities that exist in testing and in diagnosing as well. And just a little tidbit, we're talking about young African-American children. African-American children are 500% more likely to have fatal complications from asthma. And we know asthma is one of the contributing factors of how COVID-19 can become lethal. If you have asthma, you are susceptible to COVID-19 becoming lethal if you do contract COVID-19. So just wanted to put that out there in terms of what we're doing to combat this in our state, to give the folks some real-time application of things going on.
Yeah, and that task force is created, I don't know if anyone else has seen the list, but a lot of heavy hitters for public health, for health disparities. I've just been doing this work for years are on that list. I have Dr. Renee Kennedy, the Michigan Public Health Institute CEO is on there. The president for Wayne State University, he has a medical background. He has an MD. He is on that task force as well. So there are a lot of heavy hitters that are on this task force, and I'm very interested to see the things that they continue to roll out, but no doubt in my mind that they're working.
Yeah. So, man, I mean, this is a lot of great information, and these are 30-minute blocks. Let's end right here, and we'll do another one here in a couple days and check the research and see what has been updated. Look at how many states are reopening, right? Because this is going to be an ongoing conversation. As more of the economy becomes opened up, restrictions are lessened, we need to still have a safety first mentality. And so ways to combat these biases on an organization, individual, and both. So let's end right here.
Yeah, so in regards to health disparities, biases, and stigmatization caused in general, but especially during this time, it's important for us to try to mitigate some of those or decrease some of those biases and stigmas. And this is a really unique graph. I'm forgetting the organization that created it. I'll make sure I get that for the next time, the next workshop that we do. But they came up with organizational ways, individual ways, and then ways that organizations and individuals can combat biases. So if you look at the color coordination, organizations, their leadership can commit to culture change, as well as include meaningful diversity trainings within maybe onboarding and things of that sort for new employees, as well as current employees. As an individual, we can reflect on our personal biases. One common misconception that people have is that biases are only things that maybe white people may hold. No, ma'am, no, sir. Anyone can be biased. You can be biased dark skin to light skin. You can be biased from age. You can be biased on a specific gender. There are so many different ways that we are biased as individuals. So reflecting on those personal biases and trying to unpack those a little bit will help us in the long run decrease those biases and stigma. We can question and actively counter those stereotypes as well. So for example, I'm light skinned, a common stereotype that light skinned guys are soft. I combat that. That is an example of how we can counter these stereotypes. And then, of course, everyone can mentor and sponsor activities or individuals in regards to this. Cultural humility and curiosity is really important. So oftentimes we hear about cultural competency, which in turns means that you're just trying to learn more about that population or demographic or race, for example, within that specific setting, so that you're more competent about it because of maybe research or something that you need to get done, right?
Yeah.
Ability is more so this ongoing learning process that doesn't stop with competency. You always want to learn more about the culture because, as we know, for example, 1970s Black culture is completely different than 2020 Black culture, right? So having cultural humility will allow you to continue to learn about that culture for the purpose of understanding it and not just trying to learn that culture for that specific setting at that point in time. And then lastly, intentionally diversify your experiences. That doesn't mean that you just need to run out and have that one Black friend or that one white friend that you're hanging out with, right? Diversifying your experience can also mean speaking with people from different religions, speaking with people from different races, different backgrounds, different professions within their careers. Basically diversify your experiences so that your mind is expanded in a way that allows you to decrease these biases in a conscious way and makes them less unconscious.
Yeah. Yeah, I really appreciate you guys, man. This has been an amazing conversation that we've been having. And one of the things that we're going to do, we're going to continue to have this conversation with you all. One of the things that we've been talking about is, equipping ourselves with the information so that we can begin to be knowledgeable about what's going on. They said that the stock market after a pandemic comes back in a V shape or a U shape. You know what I'm saying? And so there are other opportunities that are out here. One of the things that I also want to say is we want to pause and we want to remember the frontline responders, our police force, our nurses, our doctors, right? And all those that have been deemed necessary, employees and jobs. Some of us have been afforded the opportunity to stay home while others have had to go to work every single day. I was eavesdropping on a conversation between a doctor and a nurse at one of the restaurants where you can go in and get food and like you can order. And the doctor, like, it put tears in my eyes. He was talking about how swamped they had been and how they'd been getting patients from other cities in Michigan at this particular hospital. And they both had on their masks, right? And you could see the imprint of the mask on their face. You know what I'm saying? And I was thinking, wow, we're living in two parallel worlds. I'm home, with my family. They're being asked to leave to care. And so again, we need to pause. And I want to speak to Christians. Maybe we should adopt a cop and just pick a police officer, and let's just be responsible to pray for a doctor, a nurse, a hospital. What if we adopted a hospital? What if we adopted a facility and said, this is our facility, we are going to pray for and we're going to care for those that are working on the front lines. So we are out of time. We went over because the information is so rich, and we're going to dive back into this and talk about specific things that we can do as a community to help ourselves and to help everybody. So I want to thank you for joining us. I want to thank Shomari, Tate. I want to thank Tyler Logan. You guys, I give you a good, applause. And again, folks, they didn't come on here saying they were experts. We're trying to be a part of the solution and not the problem. That's our heart, is giving out information. So here's what I want you to do. I want you to share this video. I want you to share as wide and as far as you can and ask questions. You can put them in the chat. So before we sign off, I want to check the chat and see if there are any questions that we can write down and respond to you on the next session, right? And again, we are talking to experts in the field as well as other professionals. We're just the mouthpiece, okay? So this is what some of the folks are saying. Thank you. This is great, very informative. Thank you. This discussion is more well available. There are other places that you can find this discussion. Again, great job. So again, I want to thank you guys for your encouragement in doing this, and we're just gonna dig deeper. Now I know y'all know how we are. I'm controversial, and I feel like, well, if I'm following the lead of my president, he say a whole bunch of controversial stuff.
Hey, yo, don't go drinking bleach and disinfectant.
No, we ain't doing that.
Don't go drinking that.
We're not doing that. So look, they say political correctness is out of the window. So guess what? Let's jump into the soup. Let's talk about it. Now, when we come back to this next one, we're going to put some more information in front of you that's going to make you wrestle with some of these narratives. So thank you guys for joining us, and we will see you all on the next COVID-19 update from a legislative lens and public health, public safety perspective. God bless you.
Awesome.